She writes in, Dr. Ouellette, my weekend warrior husband hurt his wrist playing soccer. He's kind of a baby when it comes to medical testing. Having said that, I'd like to know what are the most common tests or imaging techniques used to assess wrist damage. So would that be X-ray, doctor, MRI? Which one?
Right. You start with x-rays because you'll see the relationship of the bones. So for instance, you will see a scapholunate dissociation on the x-ray. That's a given. The other ligament tears you will not see because they're in the soft tissues and they don't cause dramatic shifts in the bone. So an MRI would be more appropriate for the other ligaments.
Okay, let me get this question in as well, doctor. It's from Bertram, since we still have a minute. We try to get to as many as possible. Can wrist instability be mistaken for other types of injuries such as tendonitis or fracture? Got about a minute left, doctor.
It can, and many times it is nerve or muscle weakness. So for instance, I saw 3 young men, high-level athletes, one tennis, two golf, who came in complaining of their wrists, but on exam, their entire arm was weak. All of them had just recently had a vaccine. Now, fortunately, it all resolved, but they did have positive nerve tests, which indicated that the nerves did sustain damage. Do we see that in carpal tunnel and or ulnar nerve? Yes. So every wrist instability, I always check for nerves to make sure that we don't have weakness that is also causing the instability because their muscles aren't strong.
Fantastic. And the last thing I'm going to ask you real quick is the other day I was literally rollerblading around my neighborhood and I forgot to put those things on. Danger, danger, right?
Correct. I went rollerblading once and fell, and I said, "What am I thinking? I'm a surgeon," and I stopped.
But it's so much fun. Dr.
It
Wallet, thank
is.
you so
It
much.
is.